The Western Cape remains the country's epicenter for the coronavirus. President Cyril Ramaphosa has ordered the provincial government to find more doctors and nurses to help deal with the increasing COVID-19 cases. The province has close to 29,000 cases. Nearly 1,000 people are currently in hospital receiving care, while 193 are in intensive care. To talk to us about the latest developments in that province, I'm joined on the line by Provincial Health MEC, Dr. Noma French Mbombo. MEC, thank you so much for joining us this morning. A lot of focus on those COVID-19 cases in the Western Cape. And I'm sure at times it could probably feel quite overwhelming for your team, and of course those essential frontline workers on the ground. But some reaffirming feedback from both the President and the National Health Minister. What were your main takeaways from that visit with them a couple of days ago?
Thank you, Michelle. I think the most important thing is their confirmation that they will be able to fund the shortfall, because currently as health, we have already higher expenditures. And currently we have got a shortfall of about 3.4 billion. Actually, it's us who presented our needs, specifically around the staffing, that we will need about 2,828 staff, which is the health professionals, including also the support, which is the non-clinical staff. And also the issue of the beds themselves, including the quarantine beds and also the PPE. So when the President indicated that we shouldn't be worried about money and we could be able to plan everything as we have presented to them, I think that was the part for me, at least that was an obstacle when it comes to what we're trying to do.
So what you're talking about there is basically the paperwork, the administrative side of what comes with making sure you have as many beds and equipment and human resources as possible. It's been very encouraging to hear about private hospitals working hand in hand with the public hospitals, but that in itself also comes with extra paperwork and costs. Can you explain to us how it works when we hear something like 300 ICU beds have been made available by private hospitals for the use of government? What's the paperwork and cost involved there?
For engagement, we have already been engaging with the private health before, and we even had the draft of the service level agreement, the draft on the indemnity that the clinicians need to sign. However, the issue of the negotiation of the tariffs, it rests with the national. So we're waiting for the National Health Minister to confirm that they've finalized that part, which is at the time that he was here. He has again reassured us that we shouldn't be worried, and that night he completed that part. So that was the main thing. For us, also, the part of the service level agreement, it's about what is the kind of use of the protocols, because people need to be treated the same. So you cannot refer one person to Grooterschuur ICU and the other, for example, to one of the private hospitals, and then you find that they're not treated the same. Also, as the public, you won't be able to afford medical aid rates if, for example, that the National Health Minister wouldn't have negotiated or signed that part of it. So we have been there with them, all 7 actually, big groups. Already we had such an engagement. And noting that the issue is not only now about the critical care beds, the 200. The National Health Minister managed to negotiate even further on other beds like palliative care, also the lab services, laboratory services, especially in regard to the backlog on the capacity of the testing.
Now, clinicians, of course, are learning about COVID-19 and the impact on bodies as we've learned more and more about the coronavirus. One of the developments coming through from the Western Cape at the last few days is the use of high-flow nasal oxygen. Can you tell us more about what the Western Cape doctors, especially those at Tygerberg Hospital, have discovered and what impact that's going to have on how you treat people going forward?
Some patients do need a ventilator. Some patients might be able to use the high-flow oxygen before even they go to the ventilation, especially when they are in the critical care or even in the general ward. Taking note that while the virus presents itself as a respiratory problem, but with those people with the comorbidities, for example, those with diabetes and hypertension, you'll find that it affects the blood system, quite a lot of clotting. So in some cases, you'll find that whilst the patients are still waiting, not only to go for the ICU, but the issue of them getting the anti-blood clotting interventions, which is the treatment, it is crucial. So those patients might not necessarily in need of ventilation, but they might need just an oxygen so that they could be able to breathe, to bring more oxygen so that the blood can move throughout the body. So that's what the team has already found out, that noting that internationally there have been some of the evidence actually that takes them to that direction.
Okay, just one last question before I let you go. A big talking point down in the Western Cape has always been around testing, the hotspots you decide on to visit, to do community screening as well as then testing. Explain to us about the decision around the age of which you are now focusing on, because obviously now you're dealing with much bigger numbers down in the Western Cape. This decision around whether or not to test somebody who's under 55 or just those who are over 55, explain to us the thinking there at the moment.
Okay, this is a response to the issue of the limitation on the testing capacity, because the National Health Lab had quite a backlog of the tests. Ideally, anyone who meets the criteria for testing should be tested. But however, according to the National Health, the unavailability of the testing kits and the regions internationally, it's what contributed for them to have such a backlog. So under the circumstances, you will have found that the people who are already in the hospitals, whether it's an emergency, but they are being there to be assessed, and now when there's a need for them to be tested, and then it takes longer to get the results. And therefore, it impacts also on the bed availability, because some people ended up being admitted, yet the clinicians, it's difficult for them to come up with an overall diagnosis because they're still waiting for the results. Number two, the health workers, in a shift, if one or two are positive, it means that the whole shift will end up being on quarantine, and to come back, or isolation, some of those, to come back without knowing your results, it becomes difficult. Therefore, they need to be tested. However, again, if they have to wait for far longer for the results, where some of the results generally can take over a week or two, we cannot be able to have a situation where the health workers don't know in terms of the results. So there, and three, as I indicated earlier, the people who present with existing medical conditions like diabetes and hypertension, these are the higher risk, where we have seen that not only they end up having complications, but also that's where most of the deaths are. Lastly, the over 55, the older you are, the more you have a high risk when you have COVID. Therefore, these people that I've mentioned, they need to be prioritized. So we cannot have a situation where their swabs have to be waiting in the queue with all others. Therefore, that's why we say we have to prioritize these under the circumstances that there is a limitation in the testing capacity.
Okay, thank you so much for that update, and we wish you and your team everything of the best down there in the Western Cape. That is the Health MEC, Dr. Noma French Mbombo, giving us an update on various issues affecting one of the epicenters for the coronavirus here in South Africa.